Welcome everyone to the December Learning Health System or LHS seminar series. I'm Saumya Mayapan. I'm the manager of the Learning Health System. I'm joined by our co-chairs of the Learning Health System at Women's, Dr. David Urbach and Dr. Rulan Parekh. We are very excited about today's topic. Before I introduce you to our speakers and their talk, just want to remind everyone that this seminar series is a monthly series. It launched back in September of 2023. This is now our third of this season, and so we're very happy to share that you can actually find previous sessions, the recordings, over on the website highlighted here. And of course, you're also welcome to reach out to myself or to Donata, who's our program coordinator, for further details. And on our next few slides, we just have a preview of what's to come. So you can see we've had a couple of talks already. Today, we're joined by Vancouver Coastal Health, and they'll be talking about building an LHS at their site. And in the new year, you'll get to hear about the implementation of Voxy, which is a prompt system. And yes, and then in February, we'll also hear a talk about realizing the LHS vision. We can't get enough of those kinds of talks. It's really important as we continue to build and develop our LHS here at Women's. It's very inspiring to hear from other sites. And so for the rest of the season, you'll see various talks around health equity as well as food insecurity. And in May and June, we'll highlight some internal initiatives. So in May, we'll be excited to share some of the work happening in our working groups. So we have about 3 running at the moment, and so we'll be sharing updates around an LHS data ecosystem, patient-reported outcome measures, and all about the LHS collaboratory and how we're creating a toolkit. And finally, in June, we'll cap off the season with highlighting some learning moments here at Women's. Very excited to share feature TAPME, which is the Pain Institute. And we're still looking for ideas. As you can see, we want to feature 2 initiatives. So if there's something you're involved with or you're aware of, please get in touch and we'd be happy to look into that. All right. And so before I hand it off to our presenters, I just want to, as a preview, give folks a chance to get that link for the evaluation to complete after this talk. So you have a chance now to scan that QR code or click that link, and not to worry, we'll share the link in the chat after the talk as well. Okay, so without further ado, I'm happy to introduce our talk for today. Great. And so this talk is entitled Building a Learning Health System at Vancouver Coastal Health, Early Lessons from a Community Health Services Program and the Path Ahead. And our speakers today are Dr. Krisztina Vasarhelyi and Margaret Lynn. And so Dr. Vasarhelyi is the Senior Learning Health System Lead at Vancouver Coastal Health. So she's with Vancouver Community Health Services, the Regional Public Health Program, and the Indigenous Health Research Unit. Dr. Vasarhelyi is also an embedded researcher conducting multidisciplinary cross-sector research focused on designing and improving healthcare practice, programs, and policies. She's also the co-lead on a multi-year research project funded by CIHR on building a learning community to improve dementia care transitions. In her role as LHS lead, which I'm sure I can learn very much about, she's supporting the shift to a learning culture through strategic initiatives that foster an enabling environment for a learning health system at VCH. And Margaret Lynn is a registered nurse who's passionate about older adult care. She's currently a PhD student in the School of Nursing at the University of British Columbia. She also leads regional healthy aging integrated care initiatives at the Fraser Health Authority. She was also the project coordinator with a recently completed community engagement initiatives, where patient partners, care providers, decision makers, and researchers participated in a design jam to envision a path towards a learning health system for VCH. So we're very excited. Welcome, Krisztina and Margaret. Please take it away and feel free to share your slides.
Thank you very much for the kind introduction and this wonderful opportunity to share our experiences with you as we embark on this LHS journey. And it feels like we're among friends. We are doing the same thing. We're on the same journey. So looking forward to the discussion afterwards as well. And I would also like to introduce Rini-san, who has been very, very helpful with these wonderful slides. And she's also our Learning Health System coordinator for the CIHR project in long-term care that was mentioned. So thank you, Rini. Next slide, please. I will begin by gratefully acknowledging that we are calling in from and we work and live on the land of the Coast Salish peoples in British Columbia, and including the Musqueam, Squamish, and Tsleil-Waututh nations. Next slide. And so this is what we will do today. I will start by introducing Vancouver Coastal Health to you just briefly, just so to situate our story. And you will see perhaps some similarities and differences between the Women's College Hospital and us. And then we will move on to describing our approach to trying to build a learning health system, some of the lessons learned, and our path ahead. And so briefly about VCH. The Vancouver Coastal Health Authority is one of 5 health authorities, regional health authorities in British Columbia, that works closely with the Ministry of Health to deliver acute and community healthcare services in the province. And VCH provides care to about 25% of the province's population, or about 1.25 million people. And VCH is divided into 3 main communities of care: Vancouver, Richmond, and Coastal. Next slide, please. And this is our organization at a glance. It covers a large area, geographic area. It provides almost 9,000 acute, long-term care and other beds, has a budget of over $5 billion annually, and employs a workforce of about 30,000 staff. Next slide. And so within Vancouver, because it is quite large, organizationally, we're divided into 2 sectors: the Vancouver Acute and the Vancouver Community. And Vancouver Community provides outpatient community-based services for almost 700,000 people in Vancouver. And these employ over 4,000 staff. So this is basically our concept, our context. And as you can see, we're trying to build a big movement in a large organization. Next slide, please. And this is a slide of the major program areas within Vancouver Community. And our Learning Health System program has been active in several of these already. That includes long-term care, mental health and substance use, supported housing, primary care, and urgent primary care. And our plans are to, over time, launch learning health system projects and initiatives in all community programs. And we are also closely partnered with the Regional Public Health Program and also the Regional Indigenous Health Research Unit, which is based at the VCH Research Institute, which is the research arm of VCH. Next slide, please. And so, next slide. So the Learning Health Systems program at VCH, or Vancouver Community, is quite new. So we're just 2 years old, launched in 2022, although we are building on a previous program that focused on research facilitation and capacity building. To our knowledge, we were the first dedicated LHS role in British Columbia, although since then, very quickly, more and more learning health system facilitators and leads have been hired across the province. And our general aim is to foster the learning health system culture throughout all operations within BC, and to demonstrate value for programs and patients. That's very important. That is articulated by our leadership over and over. And so our key activities are focusing on building on our existing strengths and partnerships, as well as past successes and existing resources. And so here, I would like to emphasize that we are, in some sense, a grassroots project. We are champions. We are starting new with very small invested resources in the beginning, although we have been quite successful in attracting resources for our initiatives. Next slide, please. And this depicts the structure of how we work. So an important consideration, in addition to building on what we have, on what we are good at, was also how do we include all the important perspectives in our area. And so we formed this triad where my role, the learning health system role, works very closely with an operations director and medical director who bring the operations and clinical lens to our work. We, through our facilitation and capacity building work, we have established and secured some infrastructure in the Department of Family and Community Practice. And the head of the department has recently actually moved into the role of Senior Medical Director. So through this move, we've also gained very direct senior leadership support for our program. And this infrastructure is also quite pivotal. We have some physical space where we can host researchers and research teams. It's not much, it's 2 to 3 offices. However, it has been very helpful. We do also have a research assistant role, which is currently open. Next slide, please. And so with this small team, our first goal when our program was established was, the first question was, how do we start? And so maybe I'll backtrack a little bit just to give a little bit of a historical perspective of why this shift happened. And the reason was that it was the right time, right place, right time context, because the research facilitation capacity building began in 2017. And there was a significant divide at the time in the level of research capacity between Vancouver acute and Vancouver community. There was very little in Vancouver community. However, at about the same time, there was a conference at the University of British Columbia, the Center for Health Services and Policy Research, called the System Awakens, which was about learning health systems that our group attended. And so that was a pivotal event because we were at a point in time when we were thinking about how do we build capacity for research? How do we bring evidence to action? And so this gave us a direction, a path ahead. And so when the shift to an official commitment to changing the role to a learning health system lead and creating the team structure happened, we were faced with, how do we make this big thing happen? And we adopted a learning mindset, essentially. We realized we have a lot to learn. We don't really know how to do this. So we started with the basics. We went to the literature and we learned about the basic concepts of the learning cycle, of data to knowledge to practice, and then the learning health system enabling environment. So all the things that the organization needs to create and provide and sustain for multiple learning cycles to be able to function at the same time. The next slide, please. And so this learning journey of ours has one of the aspects that it has focused on is on this enabling environment, which initially was not so clear to us of how do we make this happen? How do we create a fertile soil for building learning cycles and a learning health system? And I'm highlighting two resources that helped in our learning. One is the original model by Charles Friedman that specified the enabling environment requiring categories of people, technology, process, and policy aligned to create what he called a socio-technical environment or platform for learning cycles. And then the publication by Menir, which I'm sure you're all familiar with, specified further what would be required, what are the core values, and what are the pillars of supporting infrastructure that are relevant to Canada, and what are the relevant outcomes for our healthcare system in Canada, which is the quadruple aims of healthcare and equity. And so in our own journey, we focused in further on the pillars. So which is at the bottom of the figure in Menir's work, it's the social, scientific, policy, technological, legal, and ethical pillars. And Margaret is going to tell you about our design jam, where we worked with these pillars and adapted them to VCH. And so we combined several pillars, expanded on them, and most significantly, we actually added the Indigenous leadership and participation pillar that we felt is very important for our organization. Next slide, please. And so as our learning advanced, we, over time, which was a slow iterative process of a lot of conversations with a lot of people within our small group, and also more and more broadly within the organization and outside, eventually we were able to distill our areas of focus to these three areas. So one, we wanted to initiate and sustain activities at the learning cycle level. And so this was very similar to research facilitation, but now bringing the learning health system lens. So our priority was to close the learning loop. So research projects no longer could stop at publication, but the focus was to what could we do to support and enable clinicians and researchers within the system who are interested in research to move beyond and build in implementation plans into their work and ensure that continuous improvement is at least top of mind and part of future plans. Then the second area of activity is the enabling environment. And so we are constantly seeking ways of how we can do that, and we will highlight some activities in this area. And finally, this is the newest area for us, really the realization that we can build and do a lot, we can achieve a lot through enthusiasm and grassroots effort and championing initiatives. Ultimately, we really need, and the literature is very clear on this as well, that senior leadership support is critical for sustaining learning health system activities and ultimately a learning health system. The next slide, please. And so I will go through, together with Margaret, these three focus areas. And so initiating activities at the learning cycle level. In addition to the ones highlighted, we have many research projects where we bring this learning health system lens that I have mentioned. But the ones that I'm highlighting now, they are intentional into projects that are initiated specifically by our learning health system group with the thought of eventually achieving learning cycles in these areas. And one of the projects, so the primary care project, is completed, but all of the others are at various stages of progress. And the ones that are highlighted in green, those are projects that are based within Vancouver community. But as I mentioned, we have strong partnerships with public health and the Indigenous Health Primary Care Network. Oh, sorry, the Indigenous Health Research Unit. And so the two projects in the boxes are these partnered projects. So the next slide, please. Next slide. So what I'd like to do next, together with Margaret, is to highlight our CIHR funded project as one of our main learning cycle creating initiatives. And so these two projects are conducted in collaboration with Dr. Lillian Hung, who is a true champion of patient-oriented research. And she is also a clinical nurse specialist, so she both has the clinical and academic lens. She's an associate professor at the University of British Columbia and also a Canada Research Chair in Senior Care. And so she is the academic lead, and I am the VCH Health System lead on two projects. The first one is a Health System Impact Fellowship that focuses on the implementation of an antipsychotic reduction in long-term care. And this project, as required by that program at CIHR, is from the outset is created and developed in close partnership with health system partners. And so when we began the engagement, the first idea that has come forward, this is a very strong priority for VCH, is to reduce the inappropriate use of antipsychotics in long-term care. The second project followed a little bit of a different trajectory, and it's due to the fact that this was a call for a team grant to evaluate an existing intervention. So although structurally this was an investigator-initiated grant and project, Lillian and I, from the very beginning, we took the approach that we want to engage very strongly with patients, families, community organizations, and our VCH partners. So in the development of the grant, we held several meetings where we discussed which direction we, as a group, wanted to go, and landed on the building and evaluating of a learning community for improving dementia care transitions. And so the both projects started at the same time in September of this year. And the interesting evolution through the discussion with partners was that the broad topic of dementia care transition is a broad topic, and within that, the reduction of antipsychotics is still the key focus, and this is what our partners are most interested in. So this created a natural linkage between the two projects, and also a great opportunity that we feel can potentially bring greater impact to the research. So next slide, please. And I'll hand it over to Margaret to speak about the first of these projects.
Thank you, Krisztina. And I'm very honored to be able to share Karen's work. So Karen's is this year's CIHR Health System Impact Fellow, and she's also a PhD candidate and sessional lecturer at the UBC School of Social Work. So today I'm just sharing on behalf of Karen of her work. And we also have included a bit more detail here that if you're interested, we hope you are, after the session today, you can read a bit further. But I do want to have Karen highlight that it really is about bringing people together and the power and how powerful it is and the magic that happens from that. And one of the very first story that we've learned is in the beginning, this project, the question was only 2 questions that you see. You see the why, the what, the how. In the very beginning, it was just the what are the barriers facilitators to antipsychotic reduction strategies in the literature, and how are the strategies implemented. So you can see very academic and very clinical. And we want to mention that within this research team, there are also patient partners. And the very first question that you saw, the why is it? That question was actually raised by the patient partner. And it was such a critical question because, yeah, why? Why did it become like this? Or how are we in this situation? And we need to think about that. And who can we engage to learn those experiences? And which led to a lot of the methods and the outputs that generates afterwards. But really the key learnings through this, and we're continue to learn, and this project is also ongoing, is how beautiful it is when you bring people together. Sometimes when you're working in a silo or you're only working from one perspective or one work context, sometimes we're limited to seeing only what we know. But when we start bringing people together, and especially people from all different contexts, different walks of life, then we'll realize, whoa, there's actually a solution lying there somewhere. And there's some magic that can happen that we would not have found out without bringing people together. And we're going to share more stories like that throughout the rest of the presentation. And this is just a little taste through Karen's amazing work. And hopefully we can share more of that beautiful work in the future as well. So I'll stop there for now and pass back to Krisztina if you'd like to add more, and please continue with the presentation.
Thank you so much, Margaret. We can advance the slide, maybe. And this one here depicts the second project, the Learning Community for Dementia Care. And so the link between the 2 projects is that Karen's project focuses on informing an ongoing implementation effort within VCH through a rapid review and also implementation science approaches. However, that's a 1-year project, and once the strategy is implemented, there will be a need for ongoing continuous improvement and sustainment. And through the discussion with the partners, we have discovered this link that the learning community can be a way of doing that. And also, the engagement has revealed an important factor is that in ensuring, in addressing inappropriate antipsychotic use, operational questions play a role. So this was brought both by senior directors of the long-term care program, as well as frontline staff. And so one of the strengths that we can build on that I will also talk about later is in a long-standing partnership with Simon Fraser University around modeling and operations research. So as a result of all of these different factors, our approach has a qualitative component and a quantitative component. The qualitative component focuses on the developmental evaluation of a learning community. So developmental because it builds on an existing community of practice that we are both developing as a learning community and evaluating at the same time. And the quantitative component will work with the same team, bringing in the mathematical experts who will create a model of the system and address and optimize various issues such as staffing and scheduling and resource allocation. And so the way that we envision is that our team, through promoting communication between the experts and healthcare partners and patient partners, we will be able to have a very rich discussion and multifaceted, nuanced solutions. So next slide, please. And so now we can move on to our second area of focus. And this is about building the enabling environment for LHS. And the first one focuses on community engagement. And so this is about how do we collectively envision a learning health system at Vancouver community? And how do we create an LHS community of practice? Because we need that people power and collective effort to move this forward. And then the second is a program that launched in just in September, although we have been preparing it for over a year. And this is an embedded research pilot program. It's an 18-month pilot that aims to operationalize hybrid academic and health system partnerships, and it focuses on operations research and modeling. And next slide, please. And so I'll hand it over to Margaret again. Tell us about the Design Jam.
Thank you, Krisztina. And this was a very interesting project. I wouldn't call it just an event, even though the Design Jam was one day. But the whole learning journey and realization throughout was very interesting because just like Krisztina said, when we see what learning health system is, the definition is in the literature, is like, wow, this is amazing. And then once you keep going with the conversation, okay, how do we make this happen? And then the excitement kind of paused because no one knows exactly where to go next, which actually was a very interesting part, especially for this event. And I could see that as the project coordinator with the team and with everyone we've involved, the mindset that we all start with is, you know, what's the answer to this? How can we do this? Like, can someone give a solution? But it really was not about that. And that was a message that we had to keep reinforcing throughout the entire planning and implementation process is, well, that's why we're here together. We're finding out the answers together. And I find that oftentimes, I guess myself as a clinician or researcher, sometimes we are really focused on what is the right answer. But oftentimes the question lives in all of us, and the answer can only happen when we come together. So this was the intention of this Design Jam as well. So what you're seeing here is our last event of the whole project at that time last year. And what happened was we brought together about 25, 30 people of different occupation and walks of life. So everyone is related to Vancouver community in a way, but we do have leaders who make decisions in the health system in Vancouver community. We had patient partners, we had peer support, peer mentors, we had families, we had clinicians, and clinicians of all different backgrounds. There were physicians, there were directors, there were nurses, care aides, and really just a mix of everyone, which was what made it so beautiful too, because we all come from a different context and perspective. And the ways of how we try to encourage the conversation is what you'll see on the right side. So you'll see the pillar. This is a science and research pillar. But if you remember the previous slide, Krisztina was talking about the different pillars that are the foundations to creating an enabling learning health system environment. This is one of the pillar that we've adapted to our version. So it includes Indigenous leadership as well. And we've listed some pillar components. I'm not sure if it's easy to read here, but the pillar components are some examples of what do we mean by science and research. And a lot of these are actually informed by the literature. And the later part, you will see an example. And this is actually in-house examples and not we didn't come up with it. Is actually all the participants came up with this, because prior to this Design Jam, there was actually a storytelling session. Because first we want to understand why might people want a learning health system. We think it's cool from the literature. We think it's a great idea, but what does everyone actually think? We were able to listen to those stories, and everyone shared different types of experience and stories, and that we then compared that with what we found in the literature and the structure to see, you know, how can we approach these stories and learn from these stories and create solutions together. So this, how do I call them? The paper and sticky notes that you see on the right, this and the poster are on the same board. So this is not a Photoshop picture. It is on the same board. And we asked the questions on how do we strengthen this pillar, so this specific pillar, to serve the learning health system in Vancouver community. And that is focusing on one pillar. And we also ask, how do we break down the silos between the pillars and align them, which leads to the little flower-ish graph that you saw earlier. And just a quick context too, that it's not everyone got to work on every single pillar because of limitation of time, but we asked the participants and we offer the opportunity for them to pick 2 pillars that they're the most interested in. And of course, some people encounter the pillar that they're not familiar with at all. But afterward, when we talked with them, they actually found that, wow, it's interesting. I never thought I could talk about on this topic, but it does relate to the experience that I have. So this is how the design jam turned out. And if we could skip to the next slide. So as you can see from the pictures here, sorry, it's a bit blurry. As you can see from the pictures here, the discussion was very active. So there were, I believe, 6 groups of each pillar. And we didn't set a limit on, like how many clinicians in each group, how many patient partner. We didn't really set that. We wanted the conversation to flow, but each group did have a facilitator to help document the conversation and make sure the post-it notes does capture the conversation. And then after each group discussed, they switch a pillar and there would be group sharing sessions from each table. So that's kind of how the activities went. And we had a lot of suggestions. For example, we need to add patient story into the health system experience. We also had what you saw in the green bubble, taking what's already known and applying it without rebuilding the wheel. Because as we converse, then we realize, well, there's so many great things that already happened, but we didn't know that. Not all of us know that. And how can we learn that together? And to let the public know that changes are being made. And so much great effort is being put in. So these are just a taste of the design jam, and there's a lot more we could share, but if you're curious, please feel free to ask us. But this is how it took place, and the feedback we got was very positive. Many participants felt very hopeful and very thankful that they had the opportunity to come together and discuss together. And I will pass back to Krisztina, I think.
Thank you, Margaret.
Thank you.
I'll add to your comments that the feedback was very positive on this, and there's great interest in continuing the learning health system community of practice. So one area of focus for us for the future, we are seeking resources to be able to do that. And we have various ideas for how this community of practice could operate, and perhaps that is something, if you are interested, we could discuss that later on. I would just add as well that the format of this, so taking the pillars, asking 2 questions around how to strengthen the pillars, how to align the pillars, this structure is now we're taking it on a roadshow. So the next iteration is going to be in January, and we're working with our organization has a community of practice for quality improvement. And so we're doing this with actually a larger group. We're aiming for about 80 to 100 people to unpack the pillars further. So that'll be very exciting. Next slide, please. And so now I'll move on to embedded research. And so why, what, how of embedded research, both from the literature and our own experience, we know that embedding researchers and operationalizing a hybrid academic health system partnership is a very effective way to co-design and co-produce research that is relevant and has high impact. So that's our basis. And so we are aiming to put resources and attention to this area. Embedded research is also considered as one of the key building blocks of learning health systems. So next slide, please. And so how are we creating this? Again, we mentioned the operations research collaboration and partnership with SFU. So this builds on that as well. And we had an opportunity to access and be successful at receiving funding from the Ministry of Health. And this funding is supporting 2 scholars. They are faculty members in the Maths department at Simon Fraser Universities with expertise in operations research and epidemiological modeling. So these 2 scholars are the supervisors, along with VCH leads and co-leads of 3 research teams. And so as we structured these research teams, we paid a lot of attention of what we think might work well in terms of a structure. So each research team includes a key VCH contact, SFU graduate student, and also additional VCH and SFU members who volunteered to join. And we worked out the structure of this and the program and the activities for 18 months in a proposal, which we are still in the process of getting official senior leadership endorsement, but senior leaders are informed and are very supportive of our initiative so far. And in terms of governance, day-to-day issues and sort of guidance on removing roadblocks and moving this initiative forward is the mandate of a leadership team. So there's 11-member leadership team that is balanced between VCH leads and SFU leads. Our VCH leads is an executive director in primary care. Our co-lead is a senior director in data and analytics. So we were very thoughtful in recruiting individuals who we felt could move things forward so that this initiative is successful. There is also an advisory committee that we are assembling, and their role will be to work closely together with the leadership team to create a sustainability plan, so beyond the 18-month pilot. And we're providing various supports to the research team to help set them up for success. And these include project management plans and work plans and various other tools and training, more in terms of voluntary resources rather than over-regulating the process, but just we want to create that enabling environment so that they can work well together. And early reports from the research team has been very positive. In fact, tomorrow morning, we have our first convening for this program, and we have 30 participants joining. So excited about that. The next slide, please. And so coming back to this slide, the stars on the right side are the ones, are the projects that are a part of this embedded research program. So they are all ongoing. They have started in September. So they will be reporting on progress, but of course, currently there are no results. The focus is on co-defining the research questions which are rooted in health system priorities. However, while we were preparing this program seeking funding and endorsement and so on, we had the opportunity to essentially trial this embedded research model. And so we worked with the primary care team at Vancouver Community to address a high priority question for them. Next slide, please. And the research team together defined the question as, so the researchers and the VCH partners, as what is the optimal panel size for providers serving patients with complex care needs at 5 Vancouver Community Health Centers. And so the team co-designed a simulation model implemented as a discrete event simulation. And they were modeling essentially the booking process, which has 2 main components: walk-in patients and booked appointments. Next slide, please. And this model was then used to simulate various panel size scenarios to meet key performance indicators that were again selected in collaboration. And these were, one of them was time to next available appointment, but there was also one identified by partners as important as the amount of overbooking. So how many patients are overbooked and how often in one appointment slot. And so what did we learn? We are not yet able to share results from this study, but the team was able to generate optimal provider panel sizes, taking into account various local conditions at the community health centers, such as booking preferences and the client population characteristics. And as I mentioned, we also learned about how to work together as an integrated team, which we are now benefiting from in the new projects that are ongoing. Next slide, please. And so now we come to our last focus area. This is our newest area, it is growing and gaining momentum, which is exciting. So when we started in October of 2022, there was a lot of discussion around how to move forward and whether or not we should include the name Learning Health Systems in the lead role as well as for the program. At that time, the concept of learning health system was not well socialized at all. And so initially we did get a lot of questions. Learning health systems, what is that? Well, it turned out to be a very good decision to have done that because over time, this the concept and just the fact that such a role existed has led to a raising of awareness of what a learning health system is and a lot of beneficial and strategic conversations that are moving our entire program forward, and it's really promoting both internal and external partnerships. And so, as Margaret mentioned, in February we held the Design Jam, which really further helped to advance the learning health system conversation. And by July, the reputation of the program has reached far enough that we have started to receive requests to join discussion groups and give presentations and so on. And a group formed where we were invited to participate, which is called the LHS Interest Group. And so this group is outside the Vancouver community. So this is at the organization level. Currently, it has 7 members, including a vice president and also directors and senior leaders who are now discussing how could VCH move towards a learning health system. And in November, we invited Dr. Robert Reed and Carrie Kolaski from the Institute for Better Health. And the interest group hosted an event where they both gave presentations, and also our Vancouver Community LHS program. And there is a program in acute care, in surgical care, that is also has adopted a learning health systems model. And so we both gave presentations on this and received feedback from Rob and Carrie about what's the right way to move forward. And this other significance of this event was that this was by invitation. There were about 40 participants in, again, many senior executives and leaders across the organization. And already since that time, I'm aware of various conversations that are happening at senior levels within VCH about how could this work for us. So we're very optimistic that this is going in the right direction right now. And we continue to showcase through communication strategies and other ways that we can what we are doing and try to demonstrate the value for learning health systems. So next slide. And next slide. So here I've listed various lessons learned, but this is intended more for the group conversation and just to see what people are interested in. So instead of going through these, I would just like to highlight 3 main areas where I believe we have learned quite a lot. So one is this returning theme that organizational commitment to this endeavor is very important. The fertile soil for the seeds that we have planted has to be there for this to continue to grow. And we also learned that broad and ongoing engagement is essential. And so that means we need to have patient partners, we need to have frontline staff, managers, data experts, researchers, leaders, everyone at the table engaged and enthusiastic about this. And we need to build those authentic relationships. We need to gain and keep trust. Both are a challenge that we have to pay attention to. And it's both a challenge and a very rewarding way to work. And finally, but not least, the resources and sustainability issue is very important. And on a positive note, in this area, joining forces with academic partners is opens up many sources of funding that are not necessarily immediately available to health system partners. So we have been quite successful in our first 18 months in attracting funding. And so this demonstrates that there is interest. And I think personally that our key to success is that we take very seriously the building of authentic partnerships between academics and health system partners. Next slide, please. And so the path ahead, just a few words on that. Again, organizational commitment, we continue to work on that. We also want to engage more of our programs in LHS activities and aligning resources. So we want to learn more from our additional engagement around the pillars and how we could action them as well. And one of the great challenges that we are turning our attention to now and seeking additional funding for is operationalizing patient involvement and engagement in system and program co-design. That area needs a lot of work in our organization, but it is a high priority for us. And next slide. With that, I would like to just draw attention to the fact that it's the 3 of us here today, but already in these 2 years, we have built so many relationships, so many wonderful partnerships, and it truly is a collective impact of many individuals and organizations that can help make this happen. And with that, thank you very much for having us, and we look forward to your questions and comments.
Great. Thank you so much, Dr. Vasarhelyi and Margaret as well for a great talk. Very, very exciting to see this. I mean, I think that you highlighted some really key parts about your journey. You know, although it's a relatively young one, it's still, I mean, it's clearly it shows that you've done quite a bit. I really liked, you know, how you're collaborating and exploring together. The design jam session seems really neat. And also you're really rooting this in health system priorities. I think we have time for a couple of questions, so I'll keep an eye on the chat as well as the hands and see if anyone would like to engage further. I think Rulan, our VP of Academics, has a question. Oh, and I also see Joyce.
Okay, I'll go really fast.
Sure.
I was wondering, and thanks so much for the talk. It was great to see. I was wondering, when you engaged so early in that jam that you had with patients, how did patients even think about what a learning health system could be like? How did you frame it, and how did you get them, you know, through that whole process that day? And I noticed, and this isn't a criticism, this is just a comment, I noticed some of the patients seem much older, and I'm older, so I can't say too much, but I'm just wondering, had you thought about getting people at different age groups to think about what that meant for them?
So Margaret, I think this is a perfect question for you.
Thank you. And thank you so much for that question too. It was indeed a conversation that came up a lot, especially during the planning process. And I want to highlight too, it's not just the patient, it's also the clinician and all the researchers and every team member involved is like, what is it even? So a lot of planning time was taken on, and multiple meetings were taken on landing on a agreeable definition of learning health system. And I would say a lot of the hard work went to Krisztina of helping us navigate a lot of the researcher and finding the different definitions and really bring that to people. So even during the planning process, it has already happened. And in the design gem itself, it also happened because we also realized that not everyone will have any idea of what learning health system mean. So I definitely missed this part, but in the beginning of the design gem, we did start with kind of a presentation style where Krisztina and Dr. Hung talked about what learning health system could look like in a literature definition and what where we're hoping to go, and our ask of the participants on, we hope to achieve this definition, whatever it is, together today. And I think that landed very well with people, that they realized that, oh, like, you didn't come to me like, you know, with a specific question. It's, we are exploring this together. And I think that went from an uncertainty to a very empowering experience. And in terms of the age piece, we didn't set any age limit when we were recruiting. We did send out the invitations to 100+ people. And the participants, especially the patient partners and peer mentors, were through the support of an engagement team at VCH. And I know the participants in that database range from all over all age groups, but somehow in the end, the participants that reply sharing their interest is in not more seniors. We had, I think, people from above 30, but probably not in the picture. Does that help with the question a little bit?
Yeah, absolutely. Thank you.
Thank you. Krisztina, anything you'd like to add, or?
No, thank you.
And we'll turn it over to Joyce for the final question.
Yeah, thank you for a very fascinating implementation story. It's causing me to reflect on a lot of what I'm doing in my role as an education scientist here at Women's and implementing a learning health system. So my question is around what difficulties or tensions did you experience in the hospital setting like ours, or in your larger setting, for promoting cultural change? So we have a lot of things in education about hidden curriculums and, you know, the unspoken norms that need to be changed, and any lessons that you could give us moving forward about dealing with those tensions and uncovering them.
Thank you for that question. It's a deep question that requires a lot of thought, I think. But the first tension that comes to mind are really the operational priorities and the space for learning. So it's very difficult to create that space for learning and engagement and involvement until and unless we are able to demonstrate what the win is for the partners. So if we are able to demonstrate and paint a picture of a different future that impacts their area directly, then engagement is greatly increased. But the realities of the health system, and especially in our area and community, there are a lot of pressures, and those pressures were exacerbated by the pandemic. So we didn't really talk about that, but actually the pandemic had a major impact on this initiative, in the sense of giving an impetus and a motivation, because the pandemic really highlighted cracks in all healthcare systems, I believe, but definitely and particularly in ours, and especially in community where we're serving vulnerable populations. It became clear that it's very important. In fact, it's critical and essential to find ways to generate relevant evidence and bring it into practice. So I feel that there was a shift in attitude towards the learning health system concept and idea, which makes our initiatives, which facilitates our efforts, definitely. But we are continually competing against operational and clinical priorities.
Absolutely. Yeah. I think that's a good way to end our seminar. As you know, we do have a post-seminar chat, and we'll be seeing the three of you shortly in the next meeting. It does give us a lot to kind of discuss in that next meeting as well. Wanted to thank you once more for coming and spending the time with us and sharing, your experiences and your ongoing kind of work. And I think we learned a lot. I like the idea of a design jam. It seems really neat, something to do in person, very engaging. So thank you. And any questions for the speakers, please feel free to direct them to myself, Donata, as well as to the speakers themselves. We will have the recording available shortly. Thank you. And we'll see you soon.
Thank you.